All right. Well, thank you everybody for joining me here on our Black Friday Cyber Monday webinars. We just wanted to be able to address any questions or comments that you may have regarding KAATSU products. I actually have the KAATSU B2 device on one arm right now. It is our cordless model, which means that it is being driven by app, our app here. So I turned it on, well, let's see. I turned it on about 4 minutes ago. It's on the cut cycle mode. And as you can tell here, it's now, I have it set for, I think it was 10 seconds rest and then 45 seconds on. So you see on one side, my left side, that it's now at 285 SKUs. So as I'm doing the webinar, I'll be having my KAATSU on my left arm just for demonstration purposes. I don't know exactly where, if anybody has any questions. If you have any questions, you could put your question, write it down in the chat. You could also raise your hand, figuratively speaking, and I can answer. Um, or we could just explain, or I could just explain what KAATSU is and what it does and what it can do for you. So in lieu of uh, someone asking a question or making a comment, I'll just begin very quickly by saying KAATSU itself is a word, KAATSU. So KA means additional and ATSU means pressure. Some of you may have heard of the Japanese term shiatsu. Shi means hand, atsu means pressure or a type of massage. K just means additional pressure. And how do we apply that additional pressure? We only apply it in the upper arm and upper leg, and we apply it by these kind of bands. We have various models of our bands and when we've gone through, but really the bands themselves have not changed over the decades. The controller units have changed over time, but not the bands themselves. And what the bands do is they inflate with air, generally about for standard inflation period is 30 seconds. And then the bands deflate, and the standard deflation period is 5 seconds. So you go 30 seconds of pressure where the bands inflate, 5 seconds of pressure where the bands deflate. When they inflate, what the bands do in reality around your arm is the girth changes, it becomes smaller. And when the girth becomes smaller, you may think it is preventing blood from going into the arm or the leg, but in reality, what it's doing is it's slowing down the rate of return. So what does that do? That means that if you could look at my two hands here, I don't know about the lighting, but this hand is where I have the KAATSU on, and this hand is where I don't have the KAATSU. And this is my normal color hand, and this is my what we call our KAATSU hand. And you can tell on both sides I have a more dramatic vein distension on the on the KAATSU hand versus the non-KAATSU hand. And so what happens is every heartbeat, blood goes into the arm or leg, and when the band is inflated, the girth decreases and the rate of return of blood, which we call venous return, slows down. And we want that. The magic of KAATSU comes where you have it inflation and deflation, inflation and deflation. Every time we inflate incrementally more. So there's more air in the bands, and that means the rate of return of the blood slows down very incrementally, and we want that. We see KAATSU as a way to increase the elasticity of your vascular tissue. The outcome is muscle building, rehabilitation of connective tissue, ligaments and tendons. Maybe it's a surgery had, et cetera. Those are the outcomes. But the actual purpose of the KAATSU equipment and our protocols is to engorge a limb, your arms or legs, in blood. And that leads to a variety of processes in the body. And those processes lead to faster healing, lead to increased muscle growth, and leads to a variety of things that you do in combination with movement or exercise. So that is what KAATSU is. The word itself is additional pressure. You're putting additional pressure on your upper arms and upper legs in order to create an engorgement of blood in the limb, and then that leads to a variety of processes. So one of the processes that's very, very important, as I briefly mentioned before, is that increased elasticity. We're making the vascular tissue more elastic. Essentially, you're going younger on a vascular level. And why do you want to do that? You want to do that because you want to maintain very good blood flow, whether it's in your legs, arms, torso, head, throughout your life. When our blood circulation becomes poor or otherwise, that is not a good thing on the health scale. So what we want to do is we want to increase that elasticity of your vascular tissue. So every time your heart beats, your capillaries, veins, and arteries expand and compress as they normally should, as they naturally should. So when you have a bunch of blood in your arms or legs, when the band is inflated, and then all of a sudden it deflates, it goes back to normal. What happens is you have a rush of blood back to your torso. When that rush of blood occurs, then what happens is you the rush of blood flows against the inner walls of your capillaries or veins, and there's shear stress, just like water going through a fire tube. That leads to the next sort of domino is you create nitric oxide and vascular endothelial cells. When that happens, your vascular tissue becomes more elastic. Now, if you do movement, and right now I'm moving my hands, I'm talking with my hands. Why? A, because that's what I naturally do, and B, because it's actually a great form of exercise. The arm with my KAATSU band is actually becoming, uh, it feels like I'm building up lactate or lactic acid, in other words, because I am. And when that occurs, my central nervous system sends a signal up to my brain, and my brain releases hormone, and there are a variety of other processes occur. So again, KAATSU, increased pressure leads to engorgement of blood in the limb, which then leads to a vascular elasticity and then a variety of hormonal responses. Now, the first question that someone asked is KAATSU useful for injuries like meniscus tears? So let's look at what KAATSU does. And because my skin is a lot more pink on the arm that one has KAATSU than the other arm, what's happening is blood is being engorged in that limb, whether it's your arm or leg, whether it's your wrist, your elbow, your shoulder, whether it's your quadricep or bicep, whatever it is. So when you have something like a meniscus tear or any kind of injury on a ligament or tendon, we recommend that you do KAATSU. I'll get in the weeds here, progressive, which means you start off at a very low pressure and very gradually build up to a higher pressure over 15 or 20 minutes. And why? Because it's very easy to increase blood in our skin or our muscles. It's more difficult to increase the blood in our bones or our connective tissue. They just have fewer capillaries running through them. Obviously, you blush, you run very quickly, and your skin gets pink or red because you've got this flush of blood in your skin. Same thing with your muscles. You're working out, you're gardening, you're folding clothes, whatever you're doing, and your muscles are working, and you get a rush of blood in there. With your connective tissue, or a meniscus or a labrum, whatever part of the body that you are working on, it's got these surface capillaries, and those take time. Those take more time to be engorged. And so the best way to do that is start off with a very low pressure in what we call the KAATSU progressive mode, which starts off these slashes here represent the level of pressure that's applied. So it starts off at low pressure and then gradually builds up to a higher pressure. And that numeric value is shown as here. So because my arm is, I'm holding up the phone, and you could see the number here. If I make a muscle, or here, if I make a muscle, you can see that number go up slightly. And I don't have a big muscle, but you can see it go up to 400 or so. Why? Because the muscle, when I make a muscle, the bicep is being pushed against the bladder. Again, too many details for the question. But the question is KAATSU useful for injuries like meniscus tears? Yes. What we recommend with someone who has a meniscus tear, for someone who has something, tendonitis, labrum tear, whatever, is you continue doing whatever your orthopedic surgeon or physical therapist recommends. Always follow your healthcare professional advice. And you could overlay, or you could do what they're asking you to do with KAATSU in addition. They will be the first to tell you that of good blood flow, especially when you have a body part that's injured or torn or strained, whatever, is very good. And that's what KAATSU is. It's keeping that blood in, and that's why I've got the distension of vein distension in my hand, and that's why my hand is very, very pink compared to my normal color. The second question is, where is the vascular elasticity concentrated, or where does it occur most? Well, it occurs mostly in the limb where you have the band. However, understand that the limb is sort of the catalyst. The limb is the catalyst for an increased vascular elasticity throughout your body. And why does that occur? Because the increased elasticity comes with a molecular change, or an increase in that nitric oxide and vascular endothelial cells. However, those molecules actually flow throughout your entire body. We have one vascular system. So we use the arms and legs because that's a very convenient and easy and effective location to engorge as much blood as we safely can. So we engorge one limb in blood, and what happens is that leads to a nitric oxide vascular endothelial cell increase. Those molecules don't just sit in the limb, they actually flow throughout the body. And our research over the last 30 years started in 1994 officially or formally at the University of Tokyo Hospital, 1994. So we're at 31, going on 32 years of research. This is what we were showing throughout those years of research. If those answers were not were unclear or not specific enough, please raise your hand or ask another question. And or ask the same question, I'll answer it in a different way. But I'll continue on because the question was, can KAATSU be useful for an injury? It can be useful for an injury, whether it's a bone break, whether it's a muscle strain, whether it is a skin laceration, whether it is something like bone spur surgery, um, or the like. And each of these has a specific protocol or application. And this is what we teach at KAATSU Global. We do provide a lot of webinars. We do provide a lot of information. We do provide a lot of courses, both that come with the purchase of the equipment and additional extra courses that can be used by healthcare professionals, physical therapists, and lay people. The next question that came in is, would you typically do one limb at a time? Uh, the answer is yes and no. So me, as a fortunately healthy, able-bodied person, I always do two at a time, either my upper arms or upper legs. However, when I'm doing webinars or seminars or I'm meeting someone explaining KAATSU, I typically just use it on one arm in order to show the differences, what occurs on a KAATSU arm versus what occurs on a non-KAATSU arm. So typically, you'd use either two bands on your upper arms or two bands on your lower arms, unless you've had an injury, unless you are a paraplegic, an amputee, or you've had a stroke, maybe. Maybe you are coming back from an injury. It could be Tommy John surgery. It could be anything where one side is impacted versus your non-impacted side. So if you've had some kind of surgery on one side versus the other, we do recommend you do KAATSU on both sides. But if, let's say, you're a professional baseball player and you've had Tommy John surgery or you've had some injury and you want to get back to the field to play faster, in these cases, you could do one of two things. You can do what we call single limb KAATSU, as here. Now, I don't have any injury on my left arm, but if I did, I would do KAATSU. I would do single limb KAATSU, meaning KAATSU only on one arm versus both arms. Or with the KAATSU B2, you can actually put different pressures on the left and right side. The equivalent would be, for example, to be lifting weights. One arm is lifting with 5 pounds and the other arm is lifting at 10 pounds. You're doing the same number of repetitions. You're doing it in the same manner. You just one arm is doing it with a heavier weight, with more resistance. In the case of KAATSU, where you've got one side that is injured or one side that you want to improve better. A lot of athletes, if they're right-handed, their moves to their left side or their left-handed movements are less strong, less agile, less quick. In these cases, we can help improve the strength of the non-dominant side by putting bands on both sides, putting different pressures on the two bands. So in other words, if I want to strengthen my left side, whether it's my leg or my arm, let's say I'm a basketball player and I can go up very strongly on a layup or a dunk on my right side, but less strong, less agile on my other side, I would be doing the exercises with either one band on one leg or both bands on two legs, but applying a higher pressure on the leg that I want to get stronger. We do this often for people who have who've survived strokes. We have done this for people, let's say rowers or swimmers, people who do bilateral movement, but one arm or one leg is not as strong as the other. So um, so we actually do single limb KAATSU, but not typically if you're an able-bodied person that's looking that doesn't have any injury. Next question is, have you seen any differences in the outcomes between the B2 and C4 devices? Um, no. The reason why early on is I mentioned the bands are exactly the same no matter what the model is. So whether it's a C4, an earlier version, or B2, or a future version, the bands will remain the same. The controller unit is different. Some people like a wireless model or a cordless model. It allows greater movement. You have no worries about a tube getting in your way. Some people are more worried about EMF and don't want an additional uh, uh, what do you call it? Uh, Bluetooth um, around them. And so they use the C4. The only thing I would say, the differences come from frequency of use and application of use. So in other words, if you're using the C4 5 days a week, and theoretically you have a B2 and you're only using it twice a week, the more frequently you use KAATSU, the greater your outcomes. That's without a doubt. We've done numerous tests on this. We've tested blood, we've tested performance levels. It without a doubt, the more frequently you use KAATSU, the greater the outcomes will be. So that's the first one, frequency of use. The second is the appropriateness of use, or how tightly or snugly you're putting on the band and what pressures do you use. One of the advantages of the KAATSU progressive cycle is that it starts at a very low pressure and then gradually builds up to a higher pressure. We want that. Unfortunately, some people assume a higher pressure is better than a lower pressure. What is factually true is that the appropriate pressure is best for your body. What may be appropriate for, let's say, walking, maybe you're going to walk for half an hour or an hour with KAATSU bands on your legs. It's highly likely that the most appropriate pressure in this case is a low pressure. Let's say you wanted to build muscle or you wanted to improve your free throw shots or something, it may be more appropriate in these limited cases that your pressure, the most appropriate pressure, is a high pressure. So low doesn't mean not so good and high means good. The right pressure is appropriate for different people at different levels. So the next question would be, well, how do you know what the right pressure is? With KAATSU, because it's based on the laxity, or where the goal is increased vascular elasticity, which then leads to hormonal response. The best way to judge whether your KAATSU bands are snug or appropriately placed on your arm is what we call capillary refill time. Again, getting a little bit into the weeds, but let's dive in. So what that means is, again, normal color skin, my KAATSU color. What I'm going to do here is I'm going to put a forefinger or thumb, press it into the palm of my hand, and then release. And you can see that right now the blood is engorged in this limb, and I'm pressing and releasing. And that time that it takes for the blood to go back to that engorged color, that is your capillary refill time. The amount of time it takes for your capillaries to refill with blood. Very easy, capillary refill time. The most important thing to know is that when you press your finger in your hand, that should take no more than 3 seconds. No more than 3 seconds. If it's taking more than 3 seconds, so in other words, I'm going to press firmly, release 1001, 1002, 1003, 1004. That's the time that we're talking about. And so what you want to do is have the bands snug so that capillary refill time is 2 seconds or below. Ideally, so it's 1 second or below. So in other words, if I press here, for example, ready, go, 1,000. So it's less than a second in this case. If I pressed and it remained white, 1,001, 1,002, 1,003, then the bands would be too tight. So we want a quick capillary refill time. That is your goal. If you can get to a quick capillary refill time, for you, that's an appropriate pressure. Right now, let's see, the bands are, well, I actually just finished the band, so I'm going to stop it and then start it again. Oops, let's see. Here you go. And I'm starting at low pressure. So, and it'll continue up. I sort of lost my train of thought there, so I apologize. Next question. Very good. Next question is, how do you make that measurement of the capillary refill time on your leg? It depends if you're wearing short pants or leggings or long pants. If you're wearing short pants, then you let's say this was your knee, just right above your knee in your thigh. Do the same thing, press and release, press and release. And then you will see the blood coming back in 1 or 2 seconds. Now, typically the legs, because there's a lot more vascular tissue and muscle there. Typically, it takes a little bit longer than your arms. So if you press your thumb into your thigh or your calves or the bottom of your feet if you top of your feet if you're barefooted, 1 second will be very, very engorged. 2 seconds is usually normal. You can go up to 3 seconds and then the blood will fill back in. But if you're 3 seconds or more, then the bands are too tight. So again, we just use our forefinger or thumb, press it into our palm of your hand or your thigh or your calf or the top of your foot, and you'll get the same effect. The next question is, did I say the C4 does not have the progressive mode? So I just turned the C4 on. And if you go, I'm sorry, let me not blur this so you can see more clearly. Here we go. I'm sorry if there's too much light on me. So you see there's cycle and advanced. I'm going to hit advanced. And in the C4, you on the top, sorry about the clarity, you can see progressive on the top. So both the C4 and the B2 have the progressive mode. I'm going to just hit it here, and you choose either arms or legs. I'll hit arms. And then in both the C2 and C4, we have the standard preset that starts off very, very low and then goes up to medium, or you can customize it. You can customize it for starting out low and then going up higher, or a variety of other things. And so you sort of see the custom down here. I'm going to press custom. And then you just move the numbers upwards or downwards. So you either make it the higher pressure or lower pressure. The advantage of the B2 is that you can do that on both sides. The C4, we've got one compressor for both limbs. On the B2, we've got one compressor for each limb. So you can, the advantage of the B2 is you can do a lot more customization by each limb. So the C4, it just one pressure for both sides. B2 is one pressure for each limb. Let's see, looking at other questions here. Here's another a comment. I love my bands. I start with low for a round or two, and then I do a few rounds on medium and then 2 rounds on high. I use my bands daily on my legs. I need to use my arms more. Need to use progressive mode. Um, and actually that's probably more representative of many of our users than not. Typically, again, just in generality, when we look at the data, we see more men use the bands on their upper body and more women use the bands on their lower body. Um, that's just the way it is. I always recommend that whether you're a man or woman, young or old, able or disabled, you have a health issue or not, use both arms and legs if at all possible. Both um, use arms and then legs is typically what we recommend. Um, but I use arms mostly because I use KAATSU while I'm sitting on my computer and doing things or on a telephone call. It if I would be more I'd be less sedentary and I'd be walking more or doing stuff more. I'd be using on my legs more. So um, yes, we give the best recommendations we can. Use it on both upper body and lower body every day. Um, but we know people have preferences, myself included, because everybody has a certain lifestyle and you do things with KAATSU that fit your lifestyle. Okay. Next question. Can you talk about any studies showing cognitive or bone density improvement with KAATSU use? We do have those studies. Um, the best way to get those studies is if you can send an email to info@kaatsu.com, info at katsu, KAATSU.com, with that exact question, then within 24 hours, I will send you out the studies of those um, showing cognitive improvement or bone density improvement. Um, and well, I'll also send you a textbook written by physicians that explain the rather complicated mechanisms that those occur and why they occur. And a vast majority of these studies were done between the year 2004 and 2014, actually before we started KAATSU Global. And the reason why is we wanted to make sure that KAATSU was effective for everybody, and that includes those people with cardiac issues. Now, the team of cardiologists that I work with at the University of Tokyo Hospital, my mentors, they showed me how to use it. They were working with patients with, they had a heart attack, they had a stroke, they had stent implant, they had a variety of issues. And we wanted to make sure that KAATSU could be used with those people safely. We did that. There are certain protocols, and those protocols are what we teach today. Now, that does not mean that a professional athlete, a soldier, a young fit person um, should not follow those. They just do it perhaps longer or at higher pressure or with greater physical intensity. So before we started the company, we did those studies first. Um, it was a long, laborious process, but we wanted to make sure that we had scientific reasons and valid medical findings to back up everything we said. Next question is, what is the recommended usage time per day for the average person? So the average person and the average KAATSU user are two different age groups and demographics. Um, you may be surprised, or perhaps not, that our typical user is older. Um, I would estimate it's probably in the lower to mid 60s is our average user. And those users are looking at a very healthy, second half of their life. They want to maintain muscle mass. They want to maintain a certain level of stamina, of aerobic capacity. So, and I'm 63. So what I would recommend and what I do myself is I do at least 1 hour of KAATSU a day, but I only do it in the cut cycle mode. And I primarily do it while I'm sitting down because in my line of work, I'm usually at a computer or at a telephone and I'm sitting down throughout a majority of my day. I'm not getting the adequate adequate amount of exercise because I lead such a sedentary life. So while I'm sedentary, I put on the bands on my arms or legs and then use the KAATSU throughout the day. Um, and that's what I do every day without fail. Last week I was in Tokyo. Going there and coming back, I was using the cuts bands actually on the air flight. I was using the bands at the airport gate. I was using the bands in Japan when I was there. I took a train, I took a ferry, I took a bus, and anytime I was sitting down, not anytime, but many times I was sitting down, I was using my bands, either my arms or legs. And so I would recommend it. I do recommend my wife, my kids, etc., my parents who are 88 and 90 years old. They use the bands very similar to me. My kids mostly have a sedentary job or are in seniors in college, and my parents are, older, so they're reading a lot. They're watching some sports on TV, and so these are an ideal time for all of us to be using KAATSU on either our arms or legs. And an hour is, I would say, ideal. And once you incorporate it into your lifestyle, so in my case, I leave my KAATSU bands right near my laptop. So if I turn on my laptop, my bands are right there. I don't forget them in another room. I don't leave them in a bag. They are always right there with me. If I travel, those are the first things I put into my travel bag. I don't forget my laptop. I don't forget my phone. I don't forget my toothbrush. I don't forget my razor, and I don't forget my KAATSU bands. Um, so, I would recommend uh, half an hour on your arms, half an hour on your legs. If you do more legs than arms, that's okay. If you do more arms than legs, that's okay. But these are our recommendations. Ah, and the next question is that 30 minutes on arms and 30 minutes on legs? Yes, it is. That's my recommendation. Now, in my own case, I do more arms than I do legs, but that's because it's easier for me to do while I'm sitting here on my laptop. The previous user, she does more. She does 2 cycle sets on low, 2 cycle sets on medium, 2 cycle sets on high, and she uses it primarily on her legs. And she readily admitted she needs to use her armbands more. So, um, you know, everybody has a slight difference. And let's see, I started the bands about 4 minutes before, so it's now 5:38 on the West Coast. So I had the bands on doing this cycle mode for about 43 minutes. This is coming up on the second round of progressive cycle. So as soon as this is finished, I will take off the arm bands, and however long we take, I'll just put on the leg bands. And the question was, is the are my bands on low? They were on low. So on the progressive mode, um, you can see here they did start off here. They did start off low, and now I'm at the 15th cycle or iteration, 15th interval. And so now it is at a higher pressure. It is at 340. So it started out, I don't remember what it started out. I think it was started out at 120, I think, somewhere around there. And so I've gone low to high, and then I start low to high. But this is the progressive mode. So I have 16 repeated cycles in that process, each time increasing by 10 units. Next question is, I think what you are saying is you do 1 hour while sedentary and not while exercising. What if you're exercising? Would it still be 1 hour? Um, yes, in my case, I use the bands for 1 hour when I'm sitting down or either typing emails or on the phone, and that is most of my day. So that's when I do my KAATSU. I do KAATSU when I am exercising on occasion. And that includes everything from walking on the beach to walking my dog, etc. I personally don't do push-ups, or I don't do weights or anything with KAATSU. If I'm walking with my KAATSU, I'm actually walking not quickly, but I'm actually contracting the muscles of my arms. You know, tight, release, contract, release, contract, release. I'm doing that, but I personally don't do any resistance exercises while I'm doing KAATSU. And one of the reason is um, so the KAATSU just finished, or no, it's on its last um, cycle. My left arm, in this case, it'll be on for about 45 minutes. It's pumped up. I mean, it feels like I've been exercising. And in fact, I have. What I'm doing are what we would define as micro movements. I'm not doing bicep curls. I'm not doing resistance exercises. I'm just moving my hands, whether it's manipulating the keyboard or explaining the vascular elasticity. For my body, that is enough. 45 minutes of the cut cycle while I'm doing some micro movements with my hands and holding the phone is an isometric bicep curl. I mean, I can feel it. I couldn't do 45 minutes holding the phone on my hand with KAATSU bands on. That would be much, much too much. And so um, uh, I personally, because of my lifestyle, I'm adding KAATSU when I'm sedentary. I can add additional KAATSU if I'm exercising, but my form of exercising is mostly just walking, although that I do swim in addition. And so um, if you have a specific need or a specific goal in mind and a certain lifestyle that you want to either maintain or change or what have you, you can send those questions to us at info@kaatsu.com and just ask us, like, given my lifestyle, given my goals, what do you recommend I do with KAATSU? What's the amount of duration? What kind of exercise I can do? And we will be very helpful, very happy to answer any questions that you may have and give our recommendations. Um, the question is, I need to try the progressive mode. I just use the cycle. Yes. If you're an experienced KAATSU user, I would definitely recommend using the progressive mode. It's longer, so you don't have to mess with pressing any buttons or anything. It starts off lower, perhaps than your normal, but it ends up higher. And our vascular tissue is or it can become very elastic, and you'll find most experienced users eventually transition from the cycle mode to the progressive cycle mode. Let's see. Other questions is, okay. I think we have most of those question answered. I'm joined now by Chris Morgan. Chris is a very special person. He's an Olympic coach. In fact, his athlete beat Michael Phelps in the semifinals of the 2008 Olympics. Now, of course, Michael ended up winning the gold medal in the 200-meter freestyle, but Chris is an accomplished open water swimming and competitive pool swimming coach, and he's getting his PhD from the University of Lausanne. He's an American who grew up in Northern California near Stanford, but speaks French and Swiss German fluently. In fact, um, when Chris and I went to the Paris Olympics and Paralympics, Chris was asked to be a commentator for French television. So, welcome, Chris. I know you and I have many, many stories on how the Olympic athletes, but more importantly, how the Paralympic athletes use um, our KAATSU. And we actually had a very interesting couple. The wife won a gold medal in track, and the husband won a Paralympic medal on the track too. So Chris is a great resource for everybody, all our customers and all our partners. So if you have any specific questions for Chris, please feel free to ask.
Yeah, thank you. And apologies, I was late, Stephen.
No
Leaving
problem.
here in Boston,
Yeah,
traffic
no
can be
problem.
sometimes unpredictable.
Yeah. Well, also, uh, I'll brag a little bit more about Chris. I mean, Chris has taught everything from athletes at Boston College to the Red Sox to the Boston Bruins, and he's taught Harvard professors at the medical school. So we can never know exactly Chris's schedule because he's a lot of people want his expertise.
Well, and I think, Steve, just for the people who are here today, what's been the most profound experiences for me are the sort of the heroes we wouldn't think about, wounded warriors. I've been very privileged, and it's taken years. I've gotten a lot of confidence in my own self and using KAATSU as a tool for people who are missing limbs or have had traumatic brain injuries, and that's taken some years to just my own self have confidence, not in the safety of KAATSU because that's been proven time and time again, but more just when you work with someone who's lost a limb, you're a little hypersensitive to it. So when I've seen the outcomes, it becomes much easier. And I know we're sharing stories internally in the company with some exciting people we're working with. But I think when you see somebody who's lost a limb have a smile on their face because they have sensations that they haven't felt before in the small muscles of that limb that's either had the amputation or had some kind of neurological damage to it, it's incredibly rewarding. Like you said, worked with some very well known, have to protect their privacy, professional athletes. But yeah, that's fun. But I think when you work with the layperson, a John Smith who no one would ever know, but someone who's given their life to protect our country, and they've lost, part of their life with losing a limb, et cetera. It's very rewarding.
All right. Well, I think we've answered everybody's questions here. Chris and I will be holding these webinars throughout this Black Friday, Cyber Monday week. We're again, if you have any questions, just send them by email for info@kaatsu.com, and we'll be very happy to share our experiences and our expertise. So,
See, we have a new question
oh, okay.
in the chat from I believe it's Kari or Carrie. I
Okay.
apologize
All
if I
right.
mispronounced, but they ask, how does it help with a brain injury?
Okay. So you a very good question. So people with brain injury can put the bands either on their arms or the legs. And now consider this. You only have a finite amount of blood in your body. So there's I forget, is it four four 4 liters of blood in the body? I forget the exact number. Anyway, and now you've got the bands in the arm, and your arm is actually engorged in blood. Both your arms are engorged in blood, or both your legs are engorged in blood. This necessarily means that you have lesser blood for a moment in time in your head. Now, what happens is your brain is smart enough to know that there's lesser blood in the brain at the time. And the brain very intelligently and naturally starts to increase capillaries in the brain. You actually start to increase cerebral blood flow and volume. And this is actually one of the areas where Chris and his colleagues at the University of Lausanne are studying. It was the same exact thing that Dr. Nakajima and Dr. Morita and Dr. Sato studied in Japan 20 years ago. So when you have increased cerebral blood flow and volume in your head, this helps. And in fact, Chris and I are now working with a very well-known doctor. I won't say his name publicly, but he is now focused precisely on this point. And it's fascinating to learn from these neurologists about this point. And in fact, our very first user, very first user in the United States was a Professor Lansbury. He's a professor in neurology at the Harvard Medical School. Now, he became our user, and actually, he then became our advisor because he had rheumatoid arthritis. And this is what he did. But when he put it on as a person who studies the brain, and in his case, dementia due to or Parkinson's, Alzheimer's, etc., he understood the profound implications of KAATSU. And so what he immediately advised us on a variety of issues that have led us down this path. So that's sort of in a 30,000 foot level. I don't know, Chris, do you want to add anything to what I just said?
No, I think that was really well said. And you know, the this is sort of an unfair answer for even the person that asked, but I think we're at the beginning of understanding this at the mitochondrial level, what's happening. But how you explained it is very uh, quite well explained.
Yeah. Next question is, are there any studies on rheumatoid arthritis and KAATSU? No, there's no studies on specific diseases or illnesses with KAATSU. When we do studies, we do studies on the mechanisms of KAATSU. The outcomes are different. You probably can find some study on arthritis and BFR or KAATSU. I'm sure somebody has done that, but KAATSU, what we do is work on the fundamental mechanisms of KAATSU as opposed to a specific outcome due to KAATSU. All right, Chris, I think that's it. We're coming up on the hour.
Yeah, coming up.
All
We just
right,
have a thank you. Yeah, and I
all
think
right,
we'll be here to answer anyone's questions this week.
yeah, all right. Thank you. Goodbye.